3 ministers are coming out. So we clearly have the attention of the government now.
Montreal lawyer Eric Maldoff says Quebec's French language directive published last month is immoral. It left many in the Anglophone community worried about the availability of health services in English. According to the document, a language other than French can only be used in healthcare settings when health, public safety, or the principles of natural justice require it, including in emergencies.
The directive speaks of recognized English-speaking Quebecers and defines them as people who have an eligibility certificate for access to English education in Quebec, which, by the way, are not readily available anymore for adults.
In an open letter, Quebec wrote health establishments won't request documentation or proof. Yet Maldoff said the directive includes no obligation to provide health services in English for patients who request it.
It's not a case of anybody who prefers to get their service in English. It's not even in the power of the user, of the patient, to determine the language in which they're served. The discretion is left with the bureaucrats. That basically is a huge change from the way it used to be. And at the end of the day, the power to decide the language of service should be in the hands of the person requiring the service.
Liberal MPs Anna Gainey and Anthony Housefather raised concerns about the changes and called on Federal Health Minister Mark Holland to intervene. In a statement Friday morning, his office said that the government expects provinces not to make decisions that would impede Canadians' access to healthcare in either official language.
The only potential good news is finally at the end they say they're open to perhaps clarifying their directive, which at least opens the door a tiny crack. It's not good enough because they have to acknowledge what the problem is.
In Montreal, Alyssia Rubertucci, City News.